Welcome back to the second episode of You've Got Some Nerve podcast. Today we're going to tackle a subject associated with the place that we work in, which is stopping goaltending in Woodbury, Massachusetts. However, we're going to try to keep it open so that it's going to not just work with goaltending, what we're going to talk about, but also how it applies to other types of sporting events, baseball, basketball, etc. So what we're going to talk about today is a couple of key points that the goalie coaches here were mainly concerned with regarding training and what they see the most out of their goaltenders. So with that, we'll start off with our first one. And don't forget to like us on social media, Instagram, brought on at this point. So go ahead and take a look at that. And we'll start with the first one.
Awesome. First thing the goalie coaches really recognize. You've got the goalies, specifically, they were having trouble with their angle awareness when they were trying to go out and block the shot. They were noticing that when the shot was taken, the goalie thought that they were online, but they were actually slightly off, which obviously is opening up more of the net.
You're a bit of a shooter.
Yeah, it's kind of thing you like to see. Oh, for sure. For sure. When a goalie comes out, you're always looking for areas on the outside.
Yeah, exactly. What you do as a shooter.
Exactly.
One of the famous trust shooters from Michigan. What are you guys looking for when a goalie comes out?
Yeah, you're looking for open net. I mean, even, I would even look to see if the goalie was completely online. And obviously try to make themselves when they step out. An object comes towards you, it looks bigger than what it actually might be. So you're looking for little holes on the outside to try to hit. What we were kind of finding was a lot of these goalies, they don't really train their non-dominant.
Yeah, absolutely. It'll just not only do they not train their non-dominant eye, but we do a lot of our neurological testing, especially we do it for everybody. I don't care if you got foot pain, whatever. Do some testing. But when we have a concussion, it comes in concussion specific, we will test for it. And with the goalie, which we were very surprised to have found, is that when we're doing one specific test, there's complete obliteration of the object within the field of vision. Not just a little bit, but complete obliteration. And that was something at least I didn't expect that when we started testing with goaltenders. I figured they were all Hawkeyes.
Yeah.
Not the Iowa. We figured they all have really great visual skills.
Exactly.
And then we found out. So then we were tasked with coming up with some ways of going ahead and getting players on angle, for example, centered within the net, and also centered on the player that's coming down towards them and how they fly.
Yeah.
So we experiment. That's what we did. We practice. So we practice. We figured a couple of different ways that we would go ahead and remedy that. One of them we started using eye patching for the dominant eye, which is going to put them at a substantial, I guess you could say, handicap. So we put the person, we draw a line, and we say, okay, why don't you just go ahead and tell us if you're online? And they would tell us if they're online. And then they would look down, and they'd be offline. And then we do our interventions with the eye patching, with the hand-eye coordination, Russian box drills, whatever we were doing at the time, just trying to experiment. And then afterwards, we would test them again. This would change very little. However, they were back online. So it's not as though we're trying to change their eye dominance, like how maybe a shooter would or something like that. Well, what we're doing is trying to increase the frequency of firing of the non-dominant eye. Right? Would you agree with that?
Yeah, totally.
So a lot of people get huffy saying, well, if you go ahead and change a person's dominant eye, aren't you going to completely throw off their game?
It can't completely change it. The big thing is we're trying to make it so that the person is able to use both of them more equally.
Mm-hmm. Get input into both sides.
Of course.
People forget our eye fields. Everybody assumes that the right side is right eye field. Left eye is left eye field. It's very mixed.
Mm-hmm.
So, for example, nasal and temporal. Nasal and temporal. Off to this side, straight on. So we're going to have all these different mixes depending upon which way the head is being turned, which angles you're taking on which players, etc. And now if you start thinking about it, it's not just goaltending. Let's say you're a basketball player. You're trying to keep your center into someone's center of mass while you're playing defense. Mm-hmm. Or if you're a rugby player. Or if you're a baseball player, you're trying to center your body up to a ground ball. You put your glove down, and the glove is here, but the ball is here. So that's going to be detrimental to your play as well. And then we also have shooters that come in as well. Good, come in trying to do that. So it can be a very useful tool for many different sports. And how about seniors? Yeah, an older person comes in, right?
Yeah,
and they're always reaching for something. They're reaching for a glass, and they can go and wash it. And they reach for something, then they're off, and boom, they knock it over. Next thing you know, they're cleaning up glasses, a cut wrist. It's all kinds of problems at that point. So anybody can certainly help.
Oh, for sure.
And it's a real easy test. And then now that we know, after a little bit of work, it's pretty easy fix too.
Exactly.
Yeah, fun times.
And a lot of it's just awareness too.
Nobody really, after we did that short little clip, people didn't know that there was even the option to do it. And then how many people contacted us saying, I didn't know that this could be an issue. And then I'm always giving up my glove side. I'm always giving up my blocker side, right? Why am I always getting beaten, as Brian would say? Well, maybe it's not your fault. Maybe it's your brain's fault.
Exactly.
Instead, coaches and parents are always yelling at these kids, but not necessarily their fault. It's going to be a developmental issue, which kind of brings us to our next topic, right? And that would be primitive reflex topic. So, wow, how many people don't talk about primitive reflex when it comes to positional training, physical therapy, chiropractic, athletic training, strength and conditioning? It's gaining a little bit. I think it's gaining a little bit of traction. For sure, which is a good thing, but not as much as we'd like it to. Again, blaming kids for deficiencies that they're going to see, but not necessarily it being their fault, because nobody knows if they have a retained primitive reflex.
And they're extremely common nowadays too.
Gosh, we started evaluating not just kids, but people in their 20s, and I think we had maybe 3 out of the 3 sets of evaluations. So that had to be about 40 people. Only 3 of them didn't, and go figure, from different countries.
Yeah, exactly.
They grow up differently, different physical education demands, different movement demands, etc. And they grow up with a lot of the things that us here in the U.S. grow up with. Well, let's not talk about that. Let's stay on target.
But, I mean, if there are retained primitive reflexes, then it's going to, there is an animalistic part of the brain that is going to just utilize make it so that you can thrive. And if we do not build over top of that, it becomes a lot harder for us to, I guess, build these patterns,
like new brain pathways.
Exactly.
We develop from the bottom up. And I know the chiropractic idea, we were taught this, I think it was about 75 years ago when I graduated from chiropractic school. And I was taking my horse to campus, and I kept going over in my head the above-down, inside-out paradigm, right? Everything's above down, everything's inside out, right? And then we started thinking a little bit more about it. Probably when I started seeing some of the other things that were out there, like some Carrick's work, some Willow's work. This is going back a little bit, so I'm a little bit older. And then also that piqued an interest into the OT side of things.
Yeah.
The occupational therapy side of things. Those practitioners are just amazing. Patients and everything. It's just then if you think about it, chiropractic is right in a lot of ways. But the above down it might be good for a lot of adults that don't have a history of injuries, a history of toxic intervention, a history of trauma, a history of nutritional issues, all that.
Yeah.
So if we start thinking that, then maybe a little bit of the top-down inside-out model works pretty well. But the way the brain develops is from the bottom up. When you're born, you have these reflexes that have to be present in order for you just to get out of the womb. Just to go ahead and head for the exit or during the birth, you have to have these reflexes present.
Of course.
Right? And then they're supposed to go away. Some of them in the first 6 months, some of them within the first 2 years, but they're supposed to go away. Right? And when you have kids that come in and you test them for just something as simple as grasping reflex, and they're telling you, well, one of my problems, I just can't get my glove hand to work really well. And, we start thinking right off the bat, higher executive function, right? We start thinking dysmetria, parietal issues, things like that. But what if we go after all of that, but we don't go after just something as simple as a grasping maneuver, where that might make them, perform a closure of the glove and the puck bouncing off of it first. One particular kid we have here, he had a tremendous issue with early closure of his glove. And that's, as one of the coaches here said, it's gone in approximately 4 to 6 weeks.
Yeah.
So that was just with doing some remittance exercises for that actual reflex. I mean, who would think to look at that, right?
Yep.
OTs, and chiropractors that decide to go ahead and look into it. Some PTs, I'm sure, I don't want to make generalization.
Yeah.
So as far as primitive reflexes go here, the specific one that we were looking at was the flinch. If someone takes a slap shot and you have a flinching reflex, up and out and then down to the puck. So it's an up and out, it's a reset, and it's out to the puck. Or it's an up and out reset, and it's a waffle, depending upon which one you use. Or even a stick. If the way the technology in hockey has gone these days, I mean, I've seen your tweaks. That's weird. I've seen this play hockey. That's why I love this. Ambiguous. The technology right now is so good, and the shots are so fast, and they're so accurate. There's no time for a flinch. And everybody thinks, well, my kid, he hears the sound of the puck, and he just automatically flinches. He must be afraid of the puck. Well, or, I mean, that's tested. Absolutely.
The first second that you hear a sound or something new comes into your eye field, it's that startle reflex present. Well, in that first second, it's just going to be you reacting.
Not in the way that your new brain wants you to react. The cortex and cerebellum communicating, showing you've done this a million times. But then there's that irritating, brainstem saying, oh no, I know what we're gonna do first. Yeah, come on guys, I'm gonna go ahead, I'm gonna go around the liquor store, we're gonna get a buyer, right? Of course he's not gonna rip us off, right? So he's just gonna lead you down the wrong road, right? You're gonna get in trouble. So when the brainstem starts to interfere in places where the brainstem doesn't belong,
of course.
We have problems.
It's harder to, make a save or to react as you would like to. We all know that as you go through the ranks of any sport, the biggest differentiator, I guess, is reaction time.
Yeah, that's very, very important.
Yeah.
For example, the fighter we had here today, so he brought up a really good point because I didn't think of it in that context. And he talks about when someone shoots at your legs, when you're in, whether it's a UFC fight or one of the other cage types or something like that, and when someone shoots at your legs, you have to drop, right? Immediately go into your sprawl. And what he was experiencing was people were shooting at his legs, and instead of dropping, he was reacting inappropriately for what he was taught to do. And that inappropriateness is that brainstem then jumping in and doing what it's not supposed to. You give up your legs, next thing you know, you're stuck in guard. He's been practicing his guard defense and his guard offense so much because he's been taken down so much because of this startle reflex. Not because he doesn't know what he's doing. He's been doing it 15 years.
Yeah.
But because of that infiltration of that reflexive activity. And for catchers in baseball, same thing. What happens if they're setting up the glove and, like you were saying, something new comes into your field of vision?
Exactly.
Someone bringing an elbow in, someone bringing some hands in, someone swinging it down a little bit. Of course, right? It's going to initiate the same pathway. Right? And I don't want to say aberrant because it had a purpose.
And it's right? Just normal.
And it should be
been built in that way.
So then what do? How do we get rid of it?
There's quite a few different things that we'll do for it. We do some exercise in the ball, and then alternate both flexion and extension.
Baby in the cradle?
Yeah, baby in the cradle.
That's tough.
It is. But
and some of the for the goaltenders. and we combine activity, right?
Mm-hmm.
Some rolling back, rolling forward with some ball exercise, using some target activity, of course, right? Do all that stuff too. So, and then, oh yeah, you were here when we put the goaltender there. We just started.
Oh yeah, yeah, exactly.
Instead of every time we threw the ball, instead of his arms going up, we were like, okay, go ahead. Ball hits his chest. And he's doing the opposite of the startle maneuver instead.
Exactly.
That was a little.
Yeah, it was. But everyone had fun.
He's another one that they said his startle's gone too. Yeah. So that's kind of a big plus. So yeah, we can, if you know how to test for it and you know how to remit it, why wouldn't you add it into the strength and conditioning program, the warm up pre-ice or baseball or whatever exercise, right? It just takes minutes. Yeah. Not a long time. We can talk forever about, the strange things people do for warm-ups, whether it's pre-game or whether it's pre-workout or what have you. There's a lot of stuff that really is, it's I hate to say it, it's like the old monkey fucking a football. Yeah. We talk about that all the time, right? It's absolutely useless, right? So if you go ahead and you're just down there and you're rolling, you're stretching, and you do all this stuff that's going to do absolutely nothing for your performance, right? Do something that's going to work with your central nervous system. Because if your central nervous system isn't intact, what good is everything else? We're receptor based, but the brain interprets. Right?
You gotta train like you want to perform.
Right? Absolutely. If you want to train like a high brain person, you train like a high brain person. If you want to train scared or all these other types of maneuvers, train like that. You can play like mentally.
Well, training should be linked. The movements that you're going to be doing during the game into your everyday workout.
Yeah.
In order to build explosiveness. Kind of seeing that a lot of the goalies that we address, like they don't really have very good tone and explosiveness. Like,
what is tone?
Tone is cortical function.
Yeah. And what do they have? What do they rely upon?
And
they rely upon their brainstem, right?
Yeah.
And it seems like a very difficult concept to get through to people. And it's changeable.
Mm-hmm.
The changes aren't, and this is the problem, changes aren't permanent because there's going to be multiple stresses in these kids' lives that are going to go ahead and draw these things out again. Right? So they have to utilize these exercises. And that's why it's better if you're always going to work out, utilize them in your warm-up.
Yeah.
If you're always going to play hockey, utilize them in your warm-up.
Exactly.
And it's not difficult. It's really not difficult. And, if you've got no tone, that's why kids go to OT.
Well, and that kind of leads into the next thing.
Yeah. Absolutely.
So unilateral control, just complete body awareness.
What the coach wanted us to talk about with that, right?
Yeah.
Because he sees people that don't have the ability to lock their body in and move their arms and legs off of a stable body. Instead, they're lurching, leaning, lurching and leaning. It's difficult to get yourself back. When you're already here, you can make your maneuvers back and forth, right?
Exactly, yeah. You have to increase that core tone. When I move left to right, I want to extend the pad, right? I want to extend the glove. I still want to be able to come back in case the puck comes across.
Oh, for
sure. To the other side. You still want to be able to move explosively, but not put everything into it.
That's goaltending. Exactly. Look, we were watching the USA last night, right?
Yeah.
How did Halaman? Yeah. I mean, that's amazing.
Oh,
his statuesque posture. I mean, I'm not loving on it. Now, I'm just saying, we were looking at it from a neurological perspective where he could stay here and he could flash pads out. It was like watching Tretiak, for gosh sakes. It's a different type of goaltending, obviously, but his ability to stay upright and move his legs, like when we're working with, we were talking about before, staying online using things like a Russian box where your center of mass is right there, or Polish boxes.
Yeah.
And then being able to stabilize here and still move with accuracy your limbs. What part of the brain would that be?
I mean, that would be,
that would be interesting. Like frontal, parietal, cerebellar.
Parietal overall proprioception.
Yeah.
Being able to, with eyes both open and closed, being able to react and know exactly where your limits stays.
And having feet forward, feet back, and then I always say, F, copy, right? I always say after. That's what you have for it. I always say after. I gotta fix that. That's kind of like when I lose the coffee store. I can't remember when I put it every morning. Right there. Right there. Same thing with other sports, right? And I think we have the statistics don't really lie.
Yeah.
When you have a tremendous amount of non-contact injuries occurring, especially the old faithful, the female ACL, everybody starts talking about that. The mechanism, as far as I'm concerned, is purely neuromuscular, not neuromuscular. It's basically it's in the brain.
Yeah.
As far as my knowledge, my experience, everything else tells me. You take care of the brain, you're going to reduce the amount of non-contact ACLs in women's sport, especially soccer. Especially when we talk about that overshift. They're going to the right, they're coming back to the left. If they go to the right, stop, move back to the left. Or they overshift, go to the right, the portion of their brain that isn't necessarily working, the down regulation of that region might not be adding extensor tone, too much flexor tone. And then they blow their ACL. Then they go back and they get rehab. Right? But in between, that knee has been locked in cast. What happens to the brain? After that,
then shrinks.
Yeah, it shrinks.
Yeah.
Then you come back and it starts to get better, and they have pain, drinks it more, right? And then they have angst and anxiety and all that stuff that you have to get over with. And then they go back and they do the same strength conditioning coach. Someone asked me, he said, "What's the biggest predictor of an ACL injury and its previous ACL injury?" And I said, "No, it's going back to your previous strength and conditioning coach because they probably suck." For the most part, because if they're not looking at the brain, then they're not training people in 2024.
Yeah.
They're training people in the 1990s, the decade of the brain, which I learned then, in the last 2 decades. So that's probably why I'm not so popular anymore, because I like to change it up.
But
it's a fact. So in reality, in order to go ahead and get some type of unilateral control and body awareness, you can do a lot of things, right? You can do multiple forms of different exercises, but the thing to remember is it's not necessarily going to be just the workouts, just the exercises that you do when it comes to body control. It's also going to be a lot of toning issues. So we look at eye movements. We look at our neurological evaluation for all the dorsal column to see if there are any interferences. Upper extremity, lower extremity, spinal structures, eye structures, even the TMJ can go ahead and cause tonal output issues, right? And if that's gone, and you don't have the proper output from your brain, then you're not going to have the accuracy of movement and the unilateral control that you should be having. Now, unilateral control can also be primitive reflexive activity too. You could lose that, like we talked about earlier with grasping, like we have with the ATNIs, the STNIs, the ability to have a good spinal gallant. All of those have to be gone, right, in order to go ahead and then work off of a well-toned, I guess some people would call it the column, some people call it the core. There's so many names for it now. That's what people really have to understand. It's not just working out, right? It's the state of the brain that dictates the function of the body, right?
And that's where, like, if we have these retained primitive reflexes, it makes it much more difficult for us to, I always tell my patients, like, kind of building a house on sand versus stone, right? Anytime that you have an injury, anytime that you take it into the head, right? Some of that stuff can just wash away everything that you built, which is why they say that after getting a concussion, you're more prone to getting a concussion with worsening symptoms. And that's not always true.
Females have worse symptoms than men.
That's because a lot of times they do. They have 30% more connection between the left and right.
So much.
So much.
It takes a really recognize the fact that we're not the smartest species.
No.
Oh my gosh. That put off to the side. The evaluation for something like that could be something really simple, right? It could be just a dysphagia. You could test for dysphagia. You could muscle test. Right? You can look at the eyes. You can look at their vestibular exam as well. There's so many ways to test for something like that to see if there is an issue, and then you can build, if you have to, from the bottom up in order to go ahead and correct that unilateral control that we're looking for.
Of course.
Right? Which then we start talking about, oh boy, the old extensor pad in goaltenders. Yeah, that's it. So then I got a video. I saw a video of how they train in the Soviet Union, where they just go the whole length of the ice with their goaltenders, just pushing off, pushing off, pushing off, pushing off, and then the other way. And all I could think of was, well, that's kind of wrong.
Yeah.
Right, because the way we're thinking about it, not that I'm saying it about Russian goaltenders, you guys are pretty damn good. Yeah. We have one here. He's a great kid. I hope he comes back soon.
Oh, yeah.
But when you think about it, if you're, how to describe was if I'm here and I've got my pads down and I'm here and I stop and the rebound goes to this side, I have to then get the whole blade there, which my main motion, and then slide. Okay, so let's say puck comes in, I get it to deflect off to the left side, but now I have to turn and extend.
Well, with that lead pad.
With the lead pad extended, right?
Yeah.
So what? If I turn my head, what happens to my extensions on the right-hand side? If I have an ATR present, ATNR present,
they don't.
It doesn't work.
Yeah, exactly.
Right?
It's low tone.
That's it. You're a brainstem person at that point, and you're utilizing your brainstem, which means as soon as you turn your head, you lose extension tone on the right-hand side.
Yeah.
It's one of the ways we test it, and then a couple ways of testing it. But if you also see it on film, it's pretty obvious. Then once you put the film into looking at the actual patient on the table,
of course,
we test it there, we confirm it, and then we use, we have multiple mitigation exercises for that one. Mm-hmm. And that seems to be really, really effective. And then we can work the pathway the way we're supposed to. Now, if it's a reflexive activity, the reason why I said that the way the Russians were doing it a little bit wrong was, in order to test for that, you have to turn your head and then push off. Turn your head and then push off to see if it was actually happening, right?
Versus staying.
Keeping your eyes locked in. You have to draw it out. You have to test for it.
Yeah.
If you don't test for it, then what gets tested can then potentially get improved or get better.
Yeah.
And that's what we're looking for. And the exercises for that are multiple, and again, very, very simple to put into a person's warm-up for their training, for their on-ice activity, all that stuff.
Yeah.
But then how many pitchers have we seen that have a present ATNR and blow their elbows up?
All the time.
So what's the pitching movement?
Yeah.
Right here. Now, if you don't have an arrow, you got to get that arm slot up, You got to get the equal tone between the external rotators, internal rotators, extensors, and flexors, and all that stuff. Well, if you're not capable of turning your head and maintaining tone in your extensor system here, you can't push off. You lose, as Andrew used to say, you're going to lose velo.
Yeah.
Right? And then you're also going to lose your ability to get into extension here, so you're all going to stop at disadvantageous arm slot.
And
right?
Like this.
And what are these? Flexors. What are these? Extenders. Where does everybody come in that has an ATNR?
Oh, yeah. Exactly.
What do they end up with? Famous surgery?
Exactly.
So, just that little bit of impact for pitchers could change poor little leaguer's elbow. That could change big leaguer's elbow. That could change a lot of things. Absolutely. How long would it take for somebody to just do a few of these exercises, prior to pitching, prior to going on the field and throwing?
Get checked for it every once in a while.
And go get checked because, what if it's good and then the higher function isn't so good, right? What happens if you get some cerebellum and some dorsal column findings on the side that you throw the ball with?
Of course.
Right? Yeah. That's easy.
Yeah.
Find out where the interference is, right? Your kinesiological testing, you find out where the problems are, fix it, bring it back to its normalized tone, right?
Yeah.
What happens if it's on the other side? Right? If I throw with my right hand and we have all of our dorsal column findings on the left-hand side, what happens to that right side?
Well,
over time, because that right, especially let's say we have a massive reduction in saccadic activity coming on the right side, right?
Yeah.
You start seeing that those right prefrontal regions start to go into demise again, right?
So, what are the extension times?
How do you fix that right arm? You got to go to the left, right? You got to get those dorsal columns firing from the left, right? In order to go ahead and tonify here, down regulation of tone on the right-hand side.
Of course.
And how many kids have we seen that, he's got a rotator cuff, he's got this, he's got
an elbow. And that goes back to like the brain balance. What we do.
That's why we do an evaluation of every patient that comes in here from a nervous system perspective.
Yeah.
That's it. That's the bread and butter right there of the approach. So don't waste time with your kids. It might not be their fault. It might just be their brain, right? Mm-hmm. So what's our next little ditty that we got to talk about here?
Postural control. Which I think really everything we talked about kind of feeds into this one. But I mean, when we have multiple primitive reflexes showing up like that, you're not going to be able to really move. You're not going to use
from an athletic perspective. Yes, you have to come forth with a whole bunch of compensatory activities in order to go ahead and get your sport.
Well, and that's where we see low tone. If you don't have good tone, how are you going to explode? How are you going to be able to move powerfully? Right? You really can't. And that's going to affect every aspect of your game,
especially with goaltending. It's going to affect every aspect.
Of course.
It's going to affect your pass line. It's going to affect your centralization within the net. It's going to affect your pass line, how well you're low, giving up the top, or how well you're high, right? Not giving up the top.
Of course.
I couldn't hit a double goal shoulder, but now everybody can.
Yeah.
Right? You start going back to primitive reflexes. You start going back to our unilateral control. You start going back to our extension pad. If those systems in the body aren't working, right? If I don't know where my hand is in space, if I can't tell you where you're touching here with 2-point discrimination, for example.
When you're not seeing, you take think about how many times you blink. It might be something very, very small, and people are like, it might not affect you that much. Like, I've seen patients like post-concussion, when they blink, they almost like lose their balance.
Oh, yeah.
Which is why we test both with eyes open and closed.
Losing the horizon.
Exactly. Because that's when you check, the stimulus checking. Frontal lobe is working as well as cerebellum.
Right? The eyes integrate with the majority of our athletic centers in our brain.
Of course.
Right? If not actually the majority, they integrate with all of the athletic centers. Yeah. Your eyes aren't good, you're not going to have good postural control. Right? If your eyes aren't able, and then we've got, you've got tablets, you've got phones, right? If I turn my eyes to the right, and I can see, I turn my eyes to the left, I can see that wall. If my realm of existence in school is a tablet, little excursions. If my realm of existence out of school is a phone, my God, head down, turn, eyes down, right. Talk about plasticizing something that could be exactly the wrong thing.
Yeah.
So you're looking at these things. Your eye movements are minuscule. Mm-hmm. If I go into the gym, I grab a barbell, a dumbbell, and I'm just doing that, not going to be very effective, right? No. So if I'm moving my eye muscles a tiny little bit, what happens to my eye muscles?
They shrink.
They're muscles, Yeah. They may be under tone and control, but still, they're also under conscious control. They're under both.
Yeah.
So if you don't use your eye muscles, you lose the ability to use your eye muscles. Right? The excursion will be worse. So if you exist in a very small place, if I look my eyes up, my extensor tone goes up. If I look my eyes down, my extensor tone goes down. You see kids, what do they all do?
They're all looking down.
They're all looking down. Yep. God forbid anybody just take a little walk and start looking at the skies and the trees and all that stuff. People talk about, you got to go to the woods, it's nature, it's grounding, it's all that stuff. And I'm like, yeah, it is, but your eyes are moving. And when your eyes move and your eyes move up and they move to the side and your eyes are darting back and forth without necessarily getting head movements, because that could be added all lots of technical stuff.
You become more aware of your environment, not just something
So sometimes, in order to go ahead and increase activity, we'll get people on the ball exercises. There's a lot of stuff with the sports science exercises, and we'll have them lock their eyes on a part of the ceiling as they're doing their rotation. So their eyes are always moving while they're keeping their spinal tone, right? While their extremities are moving. Exactly. So you get the ball moving, their extremities are moving, right? The unstable surface, I know a lot of people don't like to do this, but that's fine. An unstable surface will upregulate cerebellar activity, which enhances eye.
Well, and increases cortisol.
Yeah, it downregulates positive cortisol as well. So all these little things that you can do exercise-wise to go ahead and reinforce postural control. But the important thing to remember is that you can do exercise till healthy. Right? You may never get to increasing postural control. It's the myth of postural control is that you rehab it through exercise alone.
Yeah.
You need input. You need manual input. And I know that's gone by the wayside for a lot of practices, but you have to have hands-on. You need those dorsal columns stimulated. You need pressure. You need stretch. You need tendons. You need muscle spindles. You need all that stuff working, right? You need all moving. And not just volitionally, but you also need the unconscious, right?
Yeah.
Or the, oh boy, it's the conscious and unconscious tone.
Yeah.
Right? You need the conscious and unconscious input as well. You need that. And the skills that we have to obtain in PT school, chiropractic school, massage therapy school, AT school, acupuncture, the skills we should be acquiring are just excellent hands-on skills. Because when we put hands-on to people and we put that input into the brain and then we get them off the table and put them into their exercises, I touch here, it lights up. I touch here and perturbate, it lights up more. And it lights up all through there. First order neurons, second order neurons, third order, just keep going. Right? You light up the path. I work with muscles in your mouth.
Yeah.
It lights up specific paths as well.
Exactly.
You can really do a lot of work with your hands to get people ready for exercise. That's why, like we were talking about foam roll. If you foam roll, do it painlessly.
Yeah.
Right? Because then you're increasing awareness of the brain. If you do it with pain, you're doing it the exact opposite.
Shutting it down.
You can get further from its ability to contract as opposed to facilitating it. Okay? So that's a little tangent there. We start talking about the integration between the eye movements. We start talking about the integration between the cerebellum, the vestibular nuclei. If you don't clear the primitive reflexes, what happens to people's postural control? They don't have it.
Yep, exactly.
You're not going to get it because you're always standing on ice.
Yep.
That's it. Your feet, and then we can always talk about foot training at some point. We'll do that in another podcast.
Yeah.
But for athletes, the low-hanging fruit of this whole conversation is going to be get checked.
Mm-hmm.
If you don't get checked for primitive reflexes, excuse me, then just go ahead and you can go online. You can say, I don't know if I have these. That's a pretty cool exercise. Try it.
Exactly.
Go in there. Do a couple of starfishes. Do a couple of Sphinx movements, right? With eye activities. Just try them and just put them into your daily routine and see if it helps your hockey. See if it helps your catching. See if it helps your pitching. See if it helps your rugby. Whatever you want to do, see if it helps. Notice posture. Take a pre and post.
Of course.
Right? Take a picture of yourself or have somebody take a picture of yourself and see what your posture is like and do the exercises. Hans Selye, the king of behavior, it'll take you probably 4 to 6 weeks. Yeah. That's why they say, 4 to 6 weeks. It's not because they know what they're talking about. None of us can predict exactly what's going to happen, but we can say in probably about 4 to 6 weeks, you're not going to feel much. Because you're either going to be healed or you're going to compensate through it into another joint.
Exactly.
Right? But us, we're going to look at the actual positive things as opposed to just putting a Band-Aid on it. If the cause of your issues with your angle is off, that central nervous system. If you have the inability to go ahead and downregulate a startle, that's your nervous system. If you have an inability to perform extensor movements with head rotations, that's a neurological trait. If you have the inability to control your posture, again, that could be a neurological trait. If you don't check the central nervous system, what happens?
I mean, you're building a house on sand.
House on sand, man. It's men's league.
Exactly.
And it's men's league with me. Men's league with you is good. Men's league with me, my gosh. Guys, all they do is drink in the locker room. Drink and smoke weed. What the heck? It's easy to be an old man around the corner. You have to get a longer stick, for God's sakes. Clutch, I got to grab, I got to do all that stuff. Any closing words?
Not really. I mean, you have any questions about this stuff, I mean, leave it down in the comments or reach out to us on social media. Yeah, looking forward to episode 3.
Yeah, we've got it'll be we'll get this put onto the YouTube page. It's Marchese Sports Therapy. We'll have it under what the heck are we for the is it Spotify?
Spotify.
Yeah, we're under Spotify, and that'll be under You've Got Some Nerve. Okay, You've Got Some Nerve. That's easy. Yeah, we do this just because we don't need any monetary or anything like that. Something crazy like that. We'll put it out there on Instagram under Marchese Sports Therapy and Neuro Sports Therapy. Okay, and well, thanks for viewing.
Awesome.
Nice job.
Thanks. Okay. Good job.
Keep it going.